Welcome back to the morning show here on Arise News. We're having a lovely Saturday morning, but we are moving on to a very, very serious subject matter. Now, the desperate state of primary healthcare in Nigeria at the moment was highlighted by a story here on Arise News within the week from Kebbi State in the northwest of the country, wherein patients were allegedly being admitted in hospital under relatively inhuman conditions. In the wake of that story, public reaction has been far-reaching and mostly pointed towards the need for greater accountability on the part of those who are in the position to drive policy implementation over such critical institutions, especially at subnational levels. Well, we are now being joined by two of those individuals. Yakubu Ahmed, the Kebbi State Commissioner for Information, and Dr. Shehu Nuhu Koko, who is the Permanent Secretary in the Kebbi State Ministry of Health, to respond to pertinent questions about the true state of primary health care in Kebbi. Good morning. It's a delight to welcome you to the morning show this morning.
Good morning.
Yes, good morning. Now, before we get into the pertinent topics at hand, I would first like to ask, where is Hassan Maiwaya Kangiwa, the journalist who originally posted these videos and brought attention to the state of healthcare in Kebbi State? Can we know where he is at the moment?
Well, I would want to believe that he's at home. I want to believe so. In the first place, the news making the rounds all over the country that a journalist is under arrest for taking those pictures is not true. As far as the Kebbi State government is concerned, no one is under detention on the orders of the Kebbi State government or the Kebbi State governor. I understand that people are worried about it because it involves a so-called journalist. For me, and for the government of Kebbi State, no one is under any detention for whatever reason on the orders of the Kebbi State government or Kebbi State governor.
Okay, well, thank you for that clarification. Well, let's get down to this. There is a lot of confusion surrounding this story. Can you clarify for us what is the truth about the alleged government's poor response to issues of infrastructure as small as mattresses in hospitals? We saw that video footage. We saw someone seeking and getting medical care while lying on a bed on the raw strings. No mattress, no pillow, no coverings. How true, how indicative is that of the state of hospitals in Kebbi?
Let me say this from the beginning of it. The Kebbi State Governor, Dr. Nasir Idris Arangondu, when campaigning for election, he made it clear, and everybody knew about it, that infrastructure decay in Kebbi is a front burner. He knew about it, everybody knew about it. In fact, he was elected on the crest of knowing his capacity and capability and competence to deal with the problems of infrastructure generally in Kebbi State. The pictures and videos that were shown and on which people are justifiably worried are old pictures, especially the video showing a hospital that is waterlogged. It's an old video before the coming of this administration. The picture also of the patient on hospital bed without mattress, yeah, that one is correct. But let me give you why it is so. Most of the problems we encounter today in Kebbi State, like in most states of the country, were inherited problems. The hospitals we're talking about, education and all sectors of the economy have suffered from long-term infrastructural decay, in some cases total absence of them. The governor cannot be, for whatever reason, be blamed for decay he has inherited in any kind of infrastructure. I think what should be the
excuse me, sir, I'm sorry to interrupt you.
Yeah,
he can be from the time he was inaugurated. It then becomes his own responsibility. Enough time has passed for him to remedy these issues.
Let me learn.
Go ahead, sir.
Let me learn. What I mean is that the question should have been, what has he done about the problems he inherited? And if that question is asked and answers are provided, I want to assure you that Nigerians will be satisfied with the gargantuan effort the governor has made in solving the problems in all sectors of the economy.
Okay.
We are talking about infrastructure in hospitals. And I want to assure you that quite a number of these hospitals in Kebbi State, including 14 primary healthcare centers, have all been rehabilitated. In some cases, the entire structures in terms of key component, key life-saving equipment have been provided in quite a number of hospitals. This is work in progress. The governor is providing facilities and equipment in virtually all the hospitals in Kebbi. But since it is work in progress, we should accept the fact that there is no way, even if the entire resources of Kebbi State for the past 2 years, and don't forget, this government is just 2 years in office. It's work in progress. We are moving fast. If you come over to Kebbi, and I hope you will do that, you will go around and see the wonders, the magic wand Governor Idris Karongondo has brought to bear on infrastructure development in Kebbi State. Okay. On this, yes. I would like you to take it very seriously. We have done quite a lot. I can give you a rundown of hospitals that have been revitalized and rehabilitated. As I said earlier, it's work in progress. The governor is moving forward, and I assure you, in the next couple of months and maybe a year, when you come to Kebbi, you will find that we have done quite a lot in solving those problems. The problem we face in Kebbi State at the moment, that we're approaching election, is that we have some desperate politicians, elements in Kebbi State that are vying for, of course, justifiably, we consider that to them to vie for offices. But when you hire compromised bloggers that are working, that have been paid, bringing all pictures, all videos, branding them about the country, claiming that they are recent pictures, that is not the way to go about politics. Happily for us, we are talking about Kebbi State. The people of Kebbi State are happy with what the government has done.
You're telling us that this is all political?
Pardon?
You're telling us that this is all political. Are you telling us that it is political to show the plight of the people of Kebbi State and the current and the state of the?
I gave you a background. I gave you a background to this matter. I said the governor inherited problems and he's dealing with them. The question should have been, what has the governor been doing to solve this problem?
Yes, and you've told us some of. You answered that question with telling us of some of the things the governor is doing. But I do want to ask Dr. Koko a question, because he is, of course, in the health sector. Now, Doctor, I want to ask you specifically, because, we're speaking about healthcare in Kebbi State. Can you tell us the numbers? I want the numbers when it comes to cases of malnutrition and when it comes to cases of maternal mortality, when it comes to health outcomes in Kebbi State. Have they improved over the last 2 years?
Thank you so much for this very important question. As my colleague, the Honorable Commissioner, has said, during the electioneering campaign of His Excellency, Comrade Dr. Nasir Idris Karongondo, he highlighted the issue of decay in the health sector. And he promised that when he comes on board, he is going to address squarely all those issues that are hampering the provision of quality, accessible and affordable healthcare, basic healthcare to the people of Kebbi State. And true to his words, when he came on board, when he was elected and was sworn in, he came on board, a holistic assessment and analysis of the situation of the healthcare sector in the state was made. And plans were marshaled out and how to address the challenges and also the gaps that have been identified that have been the hampering the provision of quality, accessible and affordable healthcare, basic healthcare to the people of Kebbi State. And these areas are in the area of health infrastructure, human resource for health, and also in health financing. These plans were developed and implementation was started immediately. And along the line also, these plans were reviewed in order to align them with the SWAP initiative of the present federal government under the renewed hope agenda of His Excellency the President, Suhaji Ahmed Tinubu, so that the healthcare delivery system will be overhauled to make it sustainable and also responsive to the healthcare needs of our people, the provision of quality, accessible, and affordable basic healthcare services. When the administration of the present Kebbi State government came on board, as I have said earlier, these gaps and challenges were identified.
Doctor,
and, one of the...
Doctor, sorry, I understand what you're explaining, but I just asked for the numbers. For example, with malnutrition, have you been able to reduce childhood malnutrition over the last 2 years?
Yes, that was what I'm trying to get to because all this have connection with the state of the healthcare delivery system in the state. And as you know, that malnutrition is not only the treatment of the patient of our children that are suffering from. There are other factors that are responsible, for malnutrition in our communities, which some of them are not health-related, but due to the socio-economic status of our people, for which this government is doing a lot to address those issues by way of women empowerment, and also, as we have said, making the healthcare delivery system more responsive so that our people can be able to access quality and affordable healthcare, basic healthcare services. When we were drawing of our plans in order to address the challenges and gaps in the healthcare delivery system, we also take into cognizance of our health indices and the National Demographic and Health Survey 2018 that was done, and which we recognize the fact that, yes, some of our indices are very bad, and therefore there's the need for us to come up with a comprehensive plan to address these issues. When you come to the issue of the health infrastructure, especially this is one of the issues that is making rounds in the social media platforms, that some people amplifying these issues. But to tell you the fact, the way those issues are being amplified is not as bad as it is being amplified by some misguided elements in the social media platforms. When this government came, as the Honorable Commissioner said, it made serious challenges in our health infrastructure due to many years of neglect. And the government came up with a comprehensive plan to revitalize our healthcare facilities, both the primary, secondary, and also the two tertiary health institutions we have in the state.
Okay,
Some
Dr. Koko.
primary health centers were revitalized.
If I could come in here just to ask a question, we really appreciate what you've listed here, but I just wanted to just focus on specific examples. So, for example, the Danfodio University Teaching Hospital in Sokoto is about the biggest tertiary health institution around you. What can you tell us about what the government or what the governor is doing to upgrade hospitals, at least in senatorial districts? Can you give us some specific information to that?
Yes, I'm coming to that. I'm starting from the primary healthcare centers, because they are the bedrock of if we want to achieve any meaningful universal healthcare coverage in our various states and also in the country at large. We need to reposition primary health care centers so that we'll be able to achieve this universal health coverage. So when you have a strong and functional primary health care system, you are assured of being able to provide the basic health care services which are accessible and also affordable to the people, and also which will bring about improvement in health outcomes of our people. As I have said, a lot of primary health care centers, about 14, have been revitalized, and also 73 currently are in implementation stage of their revitalization through the World Bank Impact Project. All this is being done in order to upgrade and standardize primary health care centers so that they will be able to provide quality health care services to our people. Okay. Coming to the secondary health care facilities also, as you've asked what the government is doing to improve on that level of health care. As part of the plan that were drawn up when this administration came, in realization of the fact that a lot of our people have to travel long distances from various parts of the state if the need arises for specialized secondary health care to come to the capital city, where we have the three main tertiary health institutions, that is the Federal Teaching Hospital, the State Specialist Hospital, and also the newly created State Teaching Hospital. So in realization of this, the government came up with a plan to upgrade 6 general hospitals in the state across the 3 senatorial zones, so that they will be able to provide the specialized secondary healthcare services, bringing it closer to our people. Okay. And this implementation is ongoing. One of them, located in one of the local government areas of Argungu, has already been completed. Others are in the implementation stage. There's the one in Zuru. There's another one also in Koko, Yauri, and also the specialist hospital located in the state capital.
Yes, Dr. Koko, I'd like to come in here.
That the closest tertiary health institution to Kebbi State is the Usman Danfodio University Teaching Hospital. And in realization of this, we're bringing this tertiary health care closer to our people, reducing
yes, thank you very much, Dr. Koko.
In traveling distant places.
Yes, thank you.
The state government upgraded one of the specialist hospitals located in Kalgo.
Thank you very much. Now, Dr. Koko, please, I'd like to bring Mr. Yakubu Ahmed back into the conversation, if you don't mind. Before we round up, I'd like to bring him back into the conversation.
Okay.
Thank you very much. So I'd like to ask again, please, where is the journalist Hassan Kangiwa?
I told you, I want to believe that he's at home. As I said earlier, you are asking a question believing that he has been detained by the state government. Number one, when you say a journalist, I always made the point that we don't know anybody, a journalist by that name in Kebbi State. If there's any journalist under detention, I want to believe that his employers or the correspondent general of the NUJ or the state council of the NUJ will have been there talking about it, if he's a journalist. If he's a citizen journalist, I also don't know about that. But what I know, and I want to assure you that the Kebbi State government is not in the know of the detention of anybody or under the guise of reporting anything. As far as we're concerned, we don't have any report to that effect. And I want to assure you that the Kebbi State governor, a Democrat, a unionist, a union leader, can never stoop solo to order that a citizen journalist be detained just because he has published or shared a picture of dilapidation in hospitals. The dilapidation that was brought about that has happened many, many years ago, and on which the state government is doing everything possible to rectify healthcare system across the spectrum of the entire state. I want to assure you that we are not in the know of any journalist under detention. As far as we are concerned, nobody is under detention because nobody has ordered detention of anybody in Kebbi State.
Okay.
If anybody has contrary views, let him produce. Yeah.
Okay, thank you. And I'd like to, because, we've spoken about what the governor has done, but I think even the governor himself might have believed that he was failing in the health sector, because earlier this month, a few days ago, it was reported that he had suspended the Commissioner for Health, Yunusa Ismail, for dereliction of duty. So can you explain a bit further to us why the Commissioner for Health was suspended?
Yeah, the governor, as the chief executive officer of Kebbi State, has the right to hire and fire. He has his reasons. he's privy to some information that we are not. It's likely to be for reasons of putting in more efficiency in the health sector as in other sectors. I'm sure people will be trying to link his suspension to the recent upsurge in criticisms of the health facilities and sectors in Kebbi State. But as Commissioner of Information and Culture at Kebbi State, I would like to assure you it has no connection whatsoever. The governor has his reasons. He has the right to hire and fire commissioners unlike any other employee of the state government, and he has taken his decision, and I want to believe that it's better we believe it that way.
Okay, well, thank you for that clarification. Dr. Koko, if we could bring you back into the conversation, I do want to ask you about cerebrospinal meningitis. We have seen cases of it reported less than a year ago in many local government areas, and deaths did follow those cases in Kebbi State. How prepared are you for this continuing problem?
Yes, it's quite true. Some months back, there was an outbreak of cerebrospinal meningitis in Kebbi State, which affected 3 local governments in the state, mainly Jega, Gondu, and Aliru local government areas of the state. And to show you that the state is well prepared to respond to any outbreak that occurs in the state, following the assessment of what transpired during the response activities that were carried out during the recent outbreak of cerebrospinal meningitis in the state. Due to the structures, solid structures we have on ground for response to any epidemic in the state, we were able to curtail the spread of that cerebrospinal meningitis outbreak in the state within those 3 local governments. It didn't spread to other local governments, and those were due to the concerted efforts by the state government in responding adequately with all the necessary resources that are required to respond to the outbreak. And also, this also led to this minimize the mortality rate during that outbreak. And that outbreak was successfully curtailed within those 3 local governments without spreading to other local government areas in the state. It's quite true we liaise with some of the development partners working in the state, and the government promptly released all the necessary financial and material support needed to curtail the spread of the outbreak, and also for the management of those citizens of Kebbi State that were affected with this disease. Isolation centers and treatment centers were quickly established in these 3 local governments. Sensitization activities were carried out throughout the state, and awareness was created so that people should know what measures to take in order to prevent themselves from getting infected with this disease. And that was how we were able to manage the last outbreak that took place in the state. And this goes to show you that the state is ready at any given time to respond to any epidemic outbreak within the state.
Okay, thank you very much, Dr. Koko and Mr. Ahmed. Thank you very much for joining us on the morning show today. Thank you for some of the clarifications that you've given.